Welcome to COVID-19, The Way Out. I'm your moderator, Mayan Hoffman, news editor at the Jerusalem Post, and our paper's COVID-19 health analyst. We have with us a colorful and educated playing field to help discuss the topic today, and I want to take a couple of minutes to introduce them. You might notice as the panelists come on that we are short one of our panelists tonight. Boaz Bismuth, editor-in-chief of Israel Hayom, is unfortunately sick today, and we wish him a refuah shlema. But we do have with us Tal Schneider. Tal is a freelance writer, but soon she'll be taking on the role of diplomatic and political correspondent for the Times of Israel. A lawyer by training, she spent many years as a freelance journalist, as well as serving as the Washington, D.C. correspondent for Ma'ariv. Welcome, Tal.
Hi, welcome. Thank you.
We also have with us Dr. Nachman Shai. He's an Israeli Institute visiting professor at Duke University, but he's likely best known to you for his 10 years as a member of Knesset, including serving as deputy speaker, or perhaps for his role in the first Gulf War, where he serves as the IDF spokesperson and helped to calm down the public during the Scud missiles. Nachman held diverse positions in the military, the media, the diplomatic and public arenas. He also holds a PhD in political science and communications. Welcome, Nachman.
Thank you. Good afternoon, good morning. I don't know wherever you are, but I hope you have a nice day.
Great. And last, but definitely not least, we have with us the renowned Dr. Eyal Zimlichman, who currently serves as Chief Medical Officer and Chief Innovation Officer at Sheba Medical Center, Israel's largest hospital. Prior to this, Eyal held the position of lead researcher at Partners Healthcare's Clinical Affairs Department in Boston, where he was involved in the efforts to bring about a strategic care redesign initiative. Eyal has been at the forefront of the medical fight against coronavirus, including working with startups and innovators on designing new products to help treat and serve the community during the coronavirus crisis. Eyal, thanks for being with us.
Of course, Mayan. Thank you very much.
For sure. And Eyal, I actually want to get started with you. The coronavirus cabinet met today because the country is once again in a state of high infection. As those of us who follow the news know, no decision was made, and here we are again with no new restrictions and no decision about how to calm the ever-spiking infection. But at the same time, the country's medical personnel began today by the thousands to inoculate against the coronavirus pandemic. Talk about how we're doing right now. What do people need to know?
Well, I think on one end, we're at a situation where we're confronted with a third wave here in Israel of COVID-19, and we're, I would say, very fast moving towards our third lockdown, unfortunately. We were hoping it wouldn't happen, but, we've learned, and the world has learned, that lockdowns work, and probably the only thing that does work at this point. And so I would guess that in about 2 weeks or so, we would, maybe even less than that, we would enter our third lockdown. However, I would be very pessimistic if this was only the situation and maybe a fourth lockdown would have been already in the horizon. And I say a big however because of what started today, as you mentioned, and that's the vaccination. I just got vaccinated this morning. First of all, I feel fine, no tail or horns that are growing up, as people are joking around. Just like any other flu vaccination that we're all getting every year. And I do think that has a possibility, that has a good chance of completely turning around this grim situation we're in right now. And hopefully the third wave and the third lockdown will be our last.
Wonderful. Now, thank you so much for that overview. And I think that it's helpful for everybody to kind of get perspective on what's actually happening when we watch the numbers grow, but we see the vaccines, it can be confusing. But unfortunately, COVID-19 has impacted more than just the health in our lives. It's influenced and impacted every single area. Sometimes it brought out the good of Israeli society, unity, standing on porches and singing the Manish Tanakh, but it also demonstrated some of the challenges of Israeli society. I want to start with you, Tal. Israelis have developed a tendency to blame the government for everything regarding the coronavirus crisis. Justified?
Well, hi, thank you all, and it's very nice to be here. It's an honor to be invited. As per the Israeli blaming the government, I think it's only natural when the government has, all the authorities to make the calls. I think Israelis were very, very happy at the beginning when the first lockdown went, during Passover, and immediately thereafter, the numbers of infections, just dropped to really a minimum. And they were very appreciative of the government functioning back then. But obviously, in around June, the numbers in June to July, the numbers started to pick up in a very sort of stable way, stable but still picking up. And during the entire summer, the numbers went up, and the second wave was already with us when the government discussed the second lockdown. And you could have heard the frustration back then. It wasn't only about the health issue. I think the most of the frustration here from the government is with respect to the economic situation, because those lockdowns, the first, the second, and maybe the third, are taking a huge toll on the Israeli business sector, on street stores, malls, the culture industry, and other industries in Israel are suffering very, very harshly this year. And if you compare to other countries, Western democracy, you probably would notice that the amount of help and assistance we get from the government is not as in other democracy. Having said that, the IMF, the International Monetary Fund, gave a report in November of 2020 saying Israel will recover fast in 2021. So the IMF sees us in a more of an optimistic, way of looking than we see ourselves, I suppose.
That makes sense. Nachman, maybe you can respond to Tal. Do you agree with that? That there are reasons that the government is to blame, but not everything. What do you think?
Well, I was, as Tal, I was a little bit more optimistic at the beginning, because of the history of Israel, and the people of Israel are used to be under emergency situations along our history. This is not the first time that we have to handle a kind of a national crisis, and Israelis, I would say, unfortunately, are being raised this way. But even if it worked in the first round, it didn't work even since then, and now we are in a deep economic, health, and the political crisis. All of them are combined. They come together. Tal is an expert on Israeli politics, so I hope she will contribute a little.
It seems that we're having a connection.
Let's say the average. We have difficulties in the connection?
Yep, we're hearing you again, so go ahead, Nachman.
Okay, sorry. But what I'm saying is that we dropped this opportunity. I think we should have performed much better. And the fact that Israel is engaged in 3 crises at the same time, especially the political and the health one, and they have nothing to do. Most of the resolutions or the decisions made by the government are based on political considerations and not on the health ones. And Eyal can again elaborate a lot about that. The experts that are discussing, participating in the cabinet discussions, are turned down by the power of the politicians. They manage to take the lead, but it doesn't work for the benefit of the Israelis. It works probably for the benefit of the politicians at this point. What I'm expecting is that when the time comes, I don't know where elections are going to be held, that the public will take revenge of them and will respond to that. But at this point, we are in one of the lowest points of Israel history. That's how I see it. One of the lowest points of Israel history.
And you mean one of the lowest points politically, or just one of the lowest points in general?
In general, I think when we have economically, when we have around 20%, I think this is the figure of unemployment, and it's going to be worse. Okay, and when the third lockdown is coming soon, as Eyal mentioned, Israelis don't see the future. They don't see where are we going. Where is as we say, the light at the end of the tunnel? We hardly see the tunnel, so we don't see the light at the end of the tunnel. And then the combination of lack of leadership, or leadership which is highly divided between Likud and Blue and White and other parties, and is not able to make a cohesive decisions that will show the lead for the Israelis. At a point like that, people need leadership, need direction, need to know where they are going. And one cohesive message, when it's being divided to so many voices, so many positions, so many personalities, Israelis are rightly confused. And when they are confused, they not only lose confidence, that's the other point I want to say, not only lose confidence with the government, they lose confidence with democracy, with the democratic structure of the country. That concerns me even more than anything I have said so far, because I'm asking myself where the Israeli democracy is going, towards what? What is the next stage? Will we lose the Jewish character, the democratic character of Israel? I'm not concerned about the Jewish, but the democratic character of Israel. And again, I turn to Tal, because maybe she can update us. Where do we stand vis-a-vis the current coalition negotiation? Are we going to see changes in the structure of the judicial system in Israel? The way Supreme Court, the judges are being elected? I mean, these are crucial questions, not only to the present, but also to the future of Israel.
I think you're right, and we can potentially get back to that. Since the topic today, though, is COVID-19, the way out, I want to make sure that we stay a little bit focused also on that subject. But you brought up an important point with regards to democracy. When we look around the world and we look at other democratic countries, we see that they struggled as well. Right now, we know as we're dealing with potentially shutting out members of the United Kingdom who want to come, to the country and putting them into coronavirus hotels. The UK and other areas are dealing with another strain of the virus, and they're also locking down. So Eyal, maybe you can take with this one, did any country actually do well here?
Well, it's a very, very good question, because I don't think anybody really did well. I mean, if I were looking at the entire world currently, and maybe to countries that are similar to Israel in some aspects in terms of the type of regime at least, then maybe Australia and New Zealand stand out as the only ones that really did well. I don't think we're finding anything to learn from too much in Europe, and obviously in the US, there are problems as well in regards to COVID. More totalitarian regimes, if you go to China and North Korea and other places like that, they have an edge in these types of catastrophes when you can tell the public exactly what to do, and typically they would do it. But if you talk about democratic countries, I think we're pretty much in the middle if you compare us to how other countries have fared here. And I want to point also to Europe and Germany and places that at the initial first months of the pandemic did quite well. We were trying to compare ourselves to Austria, which is a country relatively similar to ours in terms of size and number of population. And they're doing very poorly now in their second wave. So overall, when we look at the entire picture, I think many of the democratic countries have suffered from their inability, which is inherent in the democratic way of life, to enforce their citizens, whether it is to stay at home or to get vaccinated. Somebody was mentioning maybe we should have mandatory vaccinations, and it really went out the door the same second it went. It was brought up. And I think the same discussions also I heard in the UK. It was brought up in the parliament and really dropped down very quickly. So when you're dealing with a catastrophe like this and you're a democracy and you're upholding democracy, you're starting with a point where you are limited in your ability to really take control. And look and see what the Chinese have done, where they were in January and February of this year. And we were thinking, I remember we were a couple of colleagues from healthcare that were thinking maybe the virus only infects Asians, because we weren't sure how is it that it's confined to the Far East, and we're not seeing it in other countries. Just to laugh about that today, when we're seeing China and the way it came out of this versus the whole world, and the US leading the free world, and how they're confronting this. So I think there's a huge problem for countries that are democracies to deal with such a catastrophe. I am optimistic, though. Again, I'll come back to the vaccine, because I think it's the light at the end of the tunnel. Definitely today, when we've started mass vaccinations in Israel, and the vaccine is going to drive us out of this. And I'd like to come back to that later on and tell you a bit more about that, because I think it's a critical issue here.
Excellent. I'll just take 3 minutes and respond to Nachman and Eyal regarding our democracy. Where are we holding, in your perspective?
So, well, some of the criticism here is for the fact that you can treat Israel as they call it an island state. I mean, you shouldn't compare it just to other countries that have so many borders, because we only have the airport, and you can enter Israel out and in through the airport, and it should be fairly easy for Israel to control the borders. But maybe today was an example of how you control it fast. But maybe this is the first time since the entire thing began that Israel kind of moved quickly to closed off the flights from Great Britain. So up until now, we had people coming in from Dubai, for example, or from Turkey. And I'm talking about the last couple of months, bringing in the pandemic, and without any real action taken by the government to stop this. I mean, at least send them off to hotels or have them been checked at the border. So it was kind of, how do you say, not really strictly enforced. And it felt as if they put closure after closure on the citizens, specifically in the high holidays, another closure and another lockdown, whereas people who are paying the price for the lockdown are not the one that should be under more strict enforcement. So I think for the a big group of citizens in Israel who follow the rules, they felt as if they are the only one who are following the rules. I mean, for example, we had the kids out of school since March up until maybe 2 weeks ago. But on September, we witnessed some kids, specifically from the ultra-Orthodox communities, going right back to school, getting the entire environment, entire community infected, whereas the secular kids sat in the houses until just, recently. So the government is obviously not functioning very well, and it feels as if it's neglecting some of its citizens. It feels that all the decisions making are very, very political. So, for example, if the ultra-Orthodox are part of the government, then the government will take steps that will probably ease up on the ultra-Orthodox kids, and the secular community is being disregarded. I just want to kind of mitigate or maybe change my criticism a bit, because obviously ultra-Orthodox kids did not have computers at the houses, so it was very difficult, almost impossible, to have them study from the Zoom. So the government, probably was more flexible with them about the school opening, but still it was it felt very sided and very political decision making. So
Sure. No, it makes sense. And I think the whole country would see that there was an awful lot of zigzagging as well. I mean, we can just look at what happened at Hanukkah time, where we went from a night curfew to restrictions to nothing in the matter of 3 days, confusing the public, and of course showing that we don't have trust in what the government is rolling out. I think that was sort of the sentiment that we felt, we from the population. That's what the people were saying. Eyal, I want to go to you again just to talk about the healthcare system itself. What challenges have you seen with regards to Israel's healthcare system, which also wasn't necessarily as strong as it could have been, at least in terms of support from the outside, when the pandemic started? What's been challenging? What's gone well?
Well, I think we'll have time to sort of go over the entire pandemic, in about a couple of months, maybe a year from now, and summarize and draw conclusions. But I think so far, I think the healthcare system in Israel held up very well. We have a very strong healthcare system. Our problem is we're not able to respond to extreme situations. I think no healthcare system, we've seen that. Actually, just the past 3 weeks, we had a big team from Sheba fly over to North Italy to provide aid to North Italy and treat patients in hospitals in North Italy. So we've seen other healthcare systems crumble in front of this pandemic. We didn't see that in Israel. I think on one end, obviously, the healthcare system in Israel is very lean. What we have not seen is the enforcement we should have seen in terms of clinical staff. We're very lacking in clinical staff. We're very lacking in doctors, in nurses, especially when you compare it to the U.S. A hospital the size of Sheba has about 9,000 employees. In the same size hospital in the US would have about double the number of employees. That's typically how we see the difference between Israel and the US. So, because we're accustomed to this, we know how to handle these types of situations. In this case, obviously, if this would have lasted longer, or if we had more patients than we actually had, we wouldn't have been able to withstand this assault on the healthcare system. But I think the lockdowns allowed us to maintain a level of patients of severe patients and ventilated patients in the hospitals that were completely intact. So we were able to take good care of these patients. Overall, comparing to other healthcare systems in Europe and in the US, I think we've done a very good job. But that doesn't mean that we don't need more funding and more support to push ahead and move forward, mostly in terms of manpower, not so much in terms of ventilation machines, as was supposed to be the problem initially, or building a new hospital, or we need more nurses and more doctors and other healthcare professionals. That's the number one urgency that we need to tend to.
Got it. Now, we do have a couple of questions from the audience before we jump forward, and actually, Eyal, they're both for you. The first question is regarding what we've been told about the antibodies only being effective for a number of months in somebody who has coronavirus, somebody who's been diagnosed with the disease. So how will the vaccine differ from that is the question. And the other question that we'll tack on to that, given that we're going to jump over to vaccines pretty soon, is will people be able to come and visit for Passover?
That's the ultimate question. So starting with the first, we have seen from the studies on both the Pfizer and the Moderna vaccines that they create a response of antibodies that is higher than the response we see where, by somebody who contracted the virus and just was sick with the disease. That is declining slowly. So if you look 4 months after the vaccination, there's a decline of about 30 to 40% in the number of antibodies. So we don't know, because we've only followed patients in both of these studies for about 4 to 5 months. That was about it. So we don't know what happens later. But I could probably bet that this would remain for at least 6 months. We can't say anything more than that. But I think for at least 6 months, we'll be okay with the vaccines. We might need to get a second vaccine for the second 6 months. Maybe it will stand for a year, and then after a year, we'll need to get another vaccine, just like we're doing with influenza. This is pretty much what we're talking about. Now, in terms of Passover, I think there's a good chance. There's a good chance that we will be able to fly between the US and Israel and other countries. Currently, what the Ministry of Health is talking about is that if you're vaccinated, you do not need to go into isolation if you're coming in even from a red country. Which I think will open much of travels around the world. If other countries do the same, and I think they would, we would be able to see, even if the pandemic is still ongoing, we will be able to see much more international travel as long as people are vaccinated, of course.
Wonderful. Now, speaking about vaccines, they're here. They're not, and more are coming. I was at Sheba last night when I watched the Prime Minister get inoculated and the Health Minister, and was able to really see what seemed like a light at the end of the tunnel moment. Professor Kreis, who's the head of Sheba, spoke really beautifully, thinking back to the Diamond Princess, the first patients that made it their way here to Israel. Nobody then knew anything about the disease, couldn't have imagined that a year later we'd be able to start vaccinating against it. And Eyal, you already expressed, you see it as potentially something that will get us out of the virus. But it also, the pandemic, unfortunately, while it might get us out of the health of the virus, the health crisis, I think some of the dirty laundry, right, that has come up throughout the crisis that we started to talk about politically, socially in the state of Israel might not go away so quickly. Eyal, or let me move from Eyal over actually to Tal and to Nachman to take the question about, the dirty laundry that has emerged, what's going to happen as we start to get healthy and come out of these lockdowns, God willing. Tal, you start.
Yeah, I was today at the sports center in Echal Shlomo, where they are, making the infrastructure for a huge vaccination effort, which was also very exciting to just be there and see the effort. I mean, I actually, so happy to see this day coming. I have to tell you that a couple of months ago, I couldn't believe. I thought it will get here only like in April, but it's really good to see that Israel is in, first, among the nations to be vaccinated. This is just amazing, amazing process to watch. With respect to the political problems, indeed, I think we are heading towards election in 48 hours. It's not a done deal yet. There is some, slight chance, very, very small one, that Netanyahu and Gantz will come to some sort of a solution. But as time that, the clock is ticking and the deadline is approaching, for the listeners or the people who watch this program right now, we have a deadline on December 23rd at midnight. If until then the country doesn't have a budget, which it doesn't at the moment, then the 23rd Knesset is dissolved and we are going into an election that will take place on March 23rd. This will be the fourth election in less than 2 years, a dire situation. I mean, we were in this political problem in those running election one after another before the pandemic hit last year. And if we go through the pandemic and the health crisis, the economic crisis, we entered into the crisis with a government that is dysfunctioning and a Knesset that is dysfunctioning. And we were, lots of people put their trust in Netanyahu and Gantz to come to a solution. But since they brought in this unity government who was supposed to work for the people, but it didn't do it even for one day. Most of the people that I know, and even if you ask the public, they blame the prime minister because they think that he breached the agreement first and he made the major breach. I mean, he is, with the budget, that's the major part of the agreement. And he did that in order to prevent Gantz from becoming a prime minister later on in the process. So most of the people, and we had a poll tonight that also the public see Netanyahu as the main, the main problem. Having said that, he is still very popular and he's gaining most of the seats in every poll. So we are expecting probably a fourth election. And with that, we also think that Netanyahu is going to be the next prime minister as well. If you look at the numbers, it's not a clear cut, but it looks like that.
Wow. Nachman, you talked to that as well. I mean, assuming that are you assuming as well, we're definitely going to elections in 48 hours and whether we do or not, are we going to be able to rekindle the spirit here in Israel after the health crisis is over on the social and political realms,
Yeah, well, I agree with Tal that the next prime minister is the same as we are now having the same prime minister, and that will be for a long time. I mean, relatively. But I'd like one word to Eyal, and I think I absolutely agree with him that the health system in Israel has been neglected for many years. This is a miracle. I should say that every single Israeli, wherever they are, should be grateful to the to the frontliners of the health system in Israel. They have done unbelievable things to save the people of the country. Unbelievable. And I would have expected, for example, that yesterday, when the prime minister and the health minister were vaccinated, at the same time, in the same place, there'll be two other people present, a Jew and an Arab. Again, don't forget how many Arabs are there to help every single Israeli. I don't relate to the way they are being treated otherwise, but Arabs are all over. I'm sure they are also in Sheba, where Eyal is serving. I'm sure they are all over. So I'd like to see a nurse and a Jew and an Arab, two of them, being vaccinated at the same time, showing, as it was done in this country, in the United States, the first person to be vaccinated was a nurse, not the vice president. He came later, 2 days later. That's one remark. And hopefully now, every single Israeli, including the politicians, will understand that health system is not a privilege, just service. This is a service that every Israeli is entitled to get. again and again, thank you, Eyal, and all your colleagues, because what you are doing for the state of Israel at this time. And another word about politics, when I would like to emphasize that the main issue is not political, is social. And that's what exactly Tal said when she went to see the vaccination process in Echal Shlomo. All of us are exposed at the same time to the same disease or to the same pandemic. But the crisis now showed or exposed the deep gaps within the Israeli society, between Orthodox, ultra-Orthodox, and secular, between Jews and Arabs, between rich and poor. That should be the rehabilitation process, the healing process that the Israeli society should start from now on. This is the major challenge. Forget about politics. Let's start by healing the Israeli society and trying to close the gaps. They will never disappear, but to close the gaps between those. Thank you.
Thanks, definitely. So Eyal, we have a couple more questions coming in for you right now. The first question is just again regarding the mutation. If you can talk a little bit to this new mutation and what we have to worry about, also especially with regards to these vaccines that we're hoping are the light at the end of the tunnel.
Sure. I know everybody is talking about the mutation today. It's we don't know for sure yet what the implications are. We probably are seeing a mutation that causes the virus to be more infectious. So it's easier to get infected by the virus. But probably the disease itself is the same disease. It's not a more severe disease. It's the same severity in terms of the illness. And also what we think at this point is that it will respond to the virus, to the vaccine. So there's no concern, at least for now, that the vaccine is not effective against this new strain. I have to also emphasize that this is not the first mutation. We've seen at least 8 mutations already with the virus the past year, and most of them have had minor effects on the virus. And also to remind you that a mutation is not always bad, because what happened with SARS, if you remember that virus maybe 10 years ago, SARS actually disappeared because of a mutation. So a mutation can go both ways. It can turn the virus to be more virulent and more of a problem, but it can also cause the virus to be less virulent and then hopefully even disappear, as happened with SARS. It was because of a mutation. And we're likely to see these mutations. The question is how much of an effect they will have on the actual virus in terms of the some of the characteristics I mentioned.
Interesting. So what's next? You know, how much longer until things get back to normal? Eyal?
So
Also for you.
I can only speculate. I think that again, I think in about 3 to 4 months we're going to feel a substantial change. It will happen because of 2 things. One is because we're going to vaccinate most of the population that is high risk, the elderly, the comorbidities, obviously the healthcare workers. In about 4 months from now, a vast majority of them will already have been vaccinated. And that will be a huge change because remember the closings and the shutdowns and the lockdowns are in place because they want to prevent a collapse of the healthcare system. Once we get that in about 4 months, we'll take away the risk of collapse of the healthcare system. That won't be possible. And once we take away the risk of collapse of the healthcare system, we will be able to resume commerce and resume life. We'll still have the virus. People will still have to go with masks. You know, probably if you're vaccinated, you get a green passport. You'll be able to probably do a bit more things in terms of what you're able to do in the community and traveling and so on. But I think it will take a whole different course, and then probably another year or so before it completely exits our life. So I think overall, 4 months from now, the world should return pretty much to normal.
Marianne, can I say something?
Yes, please tell, of course.
Yeah, actually, talking to some experts also in the last couple of days, the rate of which the Israeli public is responding to the vaccination is pretty impressive. And according to my understanding, we're going to be in a much better position even by the end of January, mid-February. So we are probably looking at a lockdown during January, because if we have to do the lockdown right now, if we want to control the disease and not to have it, overspread. But then immediately thereafter, with this current rate of vaccination, we might be in a really, like the contamination is going to go down. So the public will be maybe, I want to say optimistic things. We probably need another lockdown for 2 weeks, and then later on we probably be free more than we expect, and maybe we can have some of the culture events coming back, and some other the stores and everything. So schools are going to stay open. So I'm even more optimistic than what has been said by the doctor.
That's good to hear. I think, there's a mixed bag. It's funny, I was having a conversation with the editor of The Lancet the other day, who actually said to me that we should look for 3 years in the other side, negative, because you need worldwide vaccination in order to actually achieve true herd
definitely
immunity.
I feel like definitely a wide family Passover is going to be in the plans. That's for sure.
Well, I hope that turns out to be the case. And let's end, by actually looking forward. We only have a few minutes left, and I definitely want us to always look forward, look at what's next. And there's always something that we can take from every crisis. There's also a lesson to be learned. So if there's one thing that Israel or even the world could save its takeaway from this pandemic, I want to ask, what should it be? Nachman, you start.
Well, I would say, I don't know how original it is, but that basically we are all equal, and we are all equal wherever we are, even if we are very rich or poor. We probably suffering from the same issues. Like when it comes to health, there's no way that anyone can buy 100% health just because he's very rich. And well, for that's reality, and I feel that that should be a message that will cross the entire globe. And I hope very much the United States, that is now undergoing very impressive political changes, will return to the major role that it has held for so many years, to lead the world and to give example to the world, and also to participate in a variety of world activities and world organizations that will save the world, literally. I mean, this disease is coming from somewhere, and it will not be able unless so many things were not done in order to save the humanity, the human being. So I think this is now the message that this country, I mean, the one I'm living now in, should assume the role of world leader and help not only the 330 million Americans now, but an entire pandemic and the future ones, and that they will come. They may come. So make the world a better place to live in. That's it.
It's a great message. Eyal, what about you? What is the one message we need to take away? What can we learn from the pandemic?
I'll say two things. One is I agree with Nachman, of course. And I think the other thing is we did not take pandemics too seriously. And we could have seen that. Some of the Far East countries like Singapore and Taiwan, Japan, had more experience with previous pandemics, and they were much better prepared. So we need to be where they are now in the next few years, and I think that's going to happen, because once we're post-COVID, it's still going to be the topic of the day for universities and major institutions, and there's going to be so much discussions around this. I'm sure we'll be better prepared for next time. But also, I want to mention one thing, and this is to applaud the science. We've got a vaccine in about a year, maybe even less than a year, which is tremendous. I think with the new methods of making vaccines in the future, and by the way, just to get everybody calm, if there was a new mutation that would not respond to the to the vaccine right now, it would probably take Pfizer and Moderna between 3 to 6 weeks to come up with a vaccine that would be effective, because it's very easy to adjust the existing vaccine to newer strains. I think the next pandemic, whether it's in 50 years from now or 100 years from now, will probably take us 2 weeks to come up with a vaccine. So just to keep that in mind, maybe for the next generations, maybe a light at the long end of the time.
Great. And Tal, of course, I want to hear from you as well. What is the message that we take away?
So Eyal kind of took my the line that I wanted to give about, you know, the greatness of the scientist and the greatness of the medical profession. I think when we will look at this year back in time, we will definitely, you know, figure out how important it was to get those scientists financed, working. You know, how the world should be thankful to the fact that we have great scientists everywhere around the world and the collaboration they made in order to get us through this. So this is really, really important for the world to put its faith in science and progress and not in some, you know, if you go 100 years back and you look at the way the pandemic was handled at first, the 1919 pandemic, obviously, at first, we used the same methods, social distancing and masks, which are simple instructions, but we needed to have the scientists with us in order to get through this as fast as we do. So I think at the end of the year, 2020 will be remembered as a very tough year, but definitely the year of the science.
Amazing. Well, on that note, I think we're going to wrap things up. I want to just remind everybody that they can join us again on January 24th for our next Israel Rundown. And remember to keep sending the IAC your questions and ideas for topics that you want to discuss. Thank you so much for everyone that tuned in, whether it's a good morning, good night, good afternoon. We're really glad that you were with us. Be healthy, be safe, and really looking forward to convening again, hopefully next time in person.
Thank you.
Thank you. Thank you,
Thank you.
everyone. Bye.